in terms of the local response to the outbreak in 2018 in New Jersey, could you explain the protocol for sort of investigating an outbreak? What's the public health response? How do we interrupt?
Yeah, to your point, we practice in New Jersey, and even though we're seeing all these outbreaks throughout the country, we're also seeing it in New Jersey as well. That demonstrates that basically these types of measles outbreaks show no borders in general. We actually, as you had mentioned, Glenn, we had a New Jersey outbreak that impacted about 33 New Jersey residents here here in our state back in the last several months, and these were all associated with a travel-associated case, an importation of an individual who had become infected while visiting a country outside of the U.S. that was experiencing an outbreak. And as soon as we hear about a report of any sort of travel-associated measles case, measles is immediately reportable to public health agencies in New Jersey. That our public health departments get into action. We have local health departments and the state health department stand ready when we hear about these particular reports. And when we get these reports, we treat them very seriously because measles is very highly infectious, as you know as a practicing physician, that it's important to try to take steps to mitigate that spread. So what we do from public health is once we get a report of a suspect measles case, we'll work closely with the local health department as well as with the treating physicians, the treating medical facilities to confirm the diagnosis, first of all, because not all febrile rash illnesses are measles.
Yes.
We get an epidemiology history. We look at travel history because the vast majority, the majority of all the measles cases that we see here in the United States and in New Jersey are all travel associated, and then we'll see the secondary cases related to the importation of measles into our state. And then after we get a confirmation that we are indeed dealing with measles, the local health department is in the process of collecting information on people who have had contact with that report of measles so that you can get an idea of who might need to have some public health interventions. And those types of disease measures include making sure you check on the immunization status. We know that the two-dose vaccination with MMR is extremely effective in preventing disease. Sometimes there will be recommendations for immunoglobulin treatment, and again, it all depends on what the circumstance is with these particular close contacts. And in the situation of our Ocean County measles outbreak that we just experienced several weeks ago, it lasted over 2 months, and this was a really terrific effort that involved the state health department, the Ocean County Health Department. It involved medical providers, the federally qualified health center down in Ocean to mount like an impressive response to try to figure out who all those contacts were, in addition to working with the federally qualified health center to run vaccination clinics to identify and to vaccinate those who might be potentially susceptible to getting measles.
Right, right. I think one challenge with measles is that it's highly contagious.
Yes.
If a child is unimmunized or vulnerable, there's a 90% likelihood they're going to get the infection if exposed. And also, if there's a space where a case has been within for up to 2 hours, the virus could still be contagious through sort of aerosol exposure. So this represents a major challenge, and there could be even many known exposures. So that sort of compounds the problem.